Hello, my name is Jacqueline Pena. I'm an RN to BSN student at Midwestern State University. My capstone project is about the teach back method and implementing it into clinical practice to improve patient outcomes. Patient education is essential in nursing care, and it's one of the first things we learn about in nursing school. The teach back method is encouraged while we're in school, but sometimes things we learn in school aren't always implemented into real world practice. It can be easy falling into a routine and just reading off instructions to the patients without making sure that they understand the instructions completely before discharge. So implementing the teach back method to every patient education encounter can ensure that everyone is on the same page. The objectives for today in this presentation, I will go over a brief case study, discuss the rationale of the capstone, discuss the background, discuss the literature review, review the proposal plan description, discuss implementation of the project, and review the evaluation and dissemination. So case study, implementing the teach back method in pediatric urology. A pilot project in pediatric urology clinic implemented the teach back method to improve caregiver understanding of postoperative care instructions. Nurses asked caregivers to repeat or demonstrate care instructions before discharge. The method led to a decrease in post-visit clarification calls, and caregivers reported feeling confident managing their child's care at home. Outcomes included fewer complications, improved follow-up, and increased caregiver satisfaction. Challenges such as time constraints and caregiver resistance were addressed by framing teachback as a way to ensure clearer communication. So, rationale and purpose. In a pediatric specialty clinic, providing clear and effective patient education is essential. Many of the families we work with face barriers like language differences, low health literacy, or confusing healthcare processes. According to Strauss and Rosenberg, only 12% of people have proficient health literacy, and over a third of surgical outpatients struggle to understand their care instructions. In our own urology clinic, we see this reflected in the volume of post-visit phone calls. About a quarter of these calls are simply caregivers asking for clarification. By using the teach-back method, we aim to make sure caregivers fully understand how to care for their child at home, which should lead to better outcomes and fewer complications and increased caregiver confidence. Background, major life changes can be overwhelming for parents, especially when their child is facing a new diagnosis or recovering from surgery. Often, postoperative instructions aren't fully understood or they're forgotten in the stress of the moment. This is even more challenging for caregivers who have limited health literacy. For example, a child who's newly diagnosed with neurogenic bladder or neurogenic bowel, the family either must quickly learn how to do catheterizations on their child or follow a bowel management plan or give new medications to their child. For these treatments to be successful, caregivers need to understand not just the how, but the why behind why we're doing things. This knowledge helps to build confidence and increases adherence to the care plan. Problem statement. So in caregivers of pediatric urology patients, how does the use of the teach-back method compared to standard verbal education affect caregiver understanding, compliance with care instructions, and post-visit discharge outcomes within 30 days? So the literature review, proven effectiveness. Research consistently supports the teach-back method as an effective way to improve patient understanding, self-care, and outcomes. Studies show it helps clarify discharge instructions, it boosts confidence, and supports better health behaviors. For example, in an article by Talevsky et al., it found that 95% of studies showed positive results like improved knowledge and medication adherence. The teach-back method also has shown success in maternal and chronic care settings. So from breastfeeding education to diabetes education and heart failure management. It's especially effective for those with low health literacy. There are some gaps in current research. There's limited research in pediatric urology specifically, and outpatient specialty clinics. More data is needed on how the teach-back method impacts caregiver confidence and reduces post-visit confusion in this specific setting. Proposal plan description. So the key stakeholders in this project are caregivers, patients, parents and patients, nurses, and urology providers. When teachback is used consistently, it helps ensure that caregivers fully understand instructions and feel more confident managing care at home. This confidence can lead to better patient outcomes and fewer complications. For healthcare staff, training is necessary to deliver teachback in a respectful and effective way. It also strengthens communication skills and builds trust between families and the care team. One major challenge is time constraints. Providers often have limited time with each patient, which makes implementation a bit difficult. So the pilot plan, the proposal will begin with a short pilot starting in the circumcision clinic with one of the providers. Nurses will use the teach-back method by having parents repeat and demonstrate post-op care right then and there before discharge home. Educational handouts will still be used, but the goal is to confirm understanding in real time. If the pilot is successful, the method will expand to all urology providers over the next 4 weeks after that. Team huddles will monitor the progress and address any issues that come up. Potential barriers include caregiver disinterest or limited appointment times. These can be managed by listening to the caregiver concerns and adjusting schedules as needed. Measuring the impact and outcomes. To evaluate success, surveys will be used to gather feedback from staff and caregivers, and data will be tracked, such as phone call volume, emergency visits, and satisfaction scores before and after implementation. If it's effective, this approach can improve caregiver confidence, reduce complications, and make education more efficient in the clinic. Evaluation. Caregivers will become more confident in their child's care at home, and the child will have a better healing process. The nurses will evaluate the amount of post-visit calls received from caregivers 7 days after the initial visit. This number should decrease as caregivers are more confident in the information that they receive immediately before discharge. Outcomes can also be evaluated through follow-up appointments for the patient. Possible barriers to evaluation are inability to get a hold of the caregiver by phone or inability of the caregiver to get to the follow-up appointment due to issues such as transportation. To evaluate the effectiveness of the teach-back method, nurses will collect both qualitative and quantitative data. One key metric used will be the number of post-visit phone calls from caregivers asking for clarification on post-visit instructions 7 days after the visit. The data will be tracked every week for 1 month before and after implementation of the proposal through the electronic health records audits. The goal is to decrease the call volume, which would indicate that there's an improved understanding of the instructions given during the visit. Caregiver confidence and comprehension will be assessed by using a custom 5-question survey that assesses their opinion on how well patient education helped them with their home care instructions. Questions on the survey will include how clear were the discharge instructions, how confident do they feel in their child's care at home, how well did the nurse or the provider explain any possible complications and how to manage it at home, were they asked to repeat the instructions using their own words, did they feel comfortable asking questions before the discharge. These surveys will be distributed immediately following discharge and collected by the front desk before the family leaves. Survey responses will be analyzed to identify common trends. Outcomes from the method will also be evaluated by a nurse, monitoring follow-up attendance and any preventable complications identified during those visits. Data will be collected through the electronic health record audits for this. The proposal will be considered effective if there's a 25% reduction in post-visit clarification calls, and 80% of caregiver scores are 4 out of 5 on the survey, and improved follow-up outcomes. Dissemination. To share this project, I'll begin with monthly team meetings where nurses already come together to discuss any clinic problems or any need for improvements. These team meetings provide the perfect platform for presenting the proposal and getting real-time feedback from the urology staff. Beyond the clinic, I plan to submit the results to the Texas Nurses Association for their annual conference, offering exposure to nurses across the state. On a national level, I hope to publish the findings in a peer-reviewed journal like Journal of Clinical Nursing. This project could also be developed into a continuing education unit or CEU, especially for nurses in specialty care clinics. To get accredited, I'll work with the education department at work or to meet the ANCC standards. So we'd have to go over learning objectives, create a content outline, and a post-session evaluation. So during my interview with the pediatric urology nurse practitioner, she emphasized how essential TeachBack is in building caregiver understanding and trust. She shared that using visuals, repetition, and asking caregivers to explain what they know helps tailor education effectively. Although some caregivers may feel like talked down at first when using the TeachBack method, presenting it as a provider like double check makes it more acceptable, because if you don't explain it, it kind of feels like you're patronizing them, and they may feel either like offended or threatened by the provider. So, in her insights, strongly support the goal of this project, to use the TeachBack method to boost caregiver confidence, reduce confusion, and improve patient outcomes in the clinic. So in summary, the TeachBack method is a proven and effective way to strengthen patient education, especially in pediatric specialty clinics where caregiver understanding is essential. It helps ensure clear communication, supports health literacy, and encourages caregivers to take an active role in their child's care. This results in better outcomes, fewer complications after procedures, and more confidence in caregivers and even the children. While it takes time and training to implement correctly, the long-term benefits like improved understanding, adherence to care plans, and stronger provider-caregiver relationship makes it well worth the effort. Ultimately, TeachBack empowers families and helps us provide safer, more effective care.